Okay, well, again, thank you for your time. And
It's really my pleasure.
okay, well, just wanted to ask you a few questions about your field as a pediatric anesthesiologist.
Okay.
And my first question was, what inspired you to pursue medicine?
As a child, I had pretty severe asthma, and I spent a lot of time going to the pediatrician. And I think early on, I kind of thought, this would be neat to be able to help people. And then I was lucky enough to do well enough in school that I thought I could follow it up. So here I am.
Okay. Well, in your experience through medicine, have you ever felt that you made a mistake in pursuing medicine?
Not a mistake. I've done other things. Before, I didn't go straight through to medical school. I did a PhD and did a lot of research for a number of years first, and then went back into medicine. And I sometimes wish I could do more of the research side and less of the day-to-day care side, because I think there's a lot that we still don't know, and we need people in those areas, and I don't get an opportunity to do that as much as I would have liked.
Okay. Well, you kind of just got into it a little bit, but could you tell me more about a typical work day for you?
Sure. A typical work day starts about 6:15 or 6:30 in the morning. We get there and we find out what different operations we might be doing for the day. And we go and see the patients and interview them and make sure that all of the necessary testing and care that should be done before the operation has been done, and review all those results. And then we'll go back and actually start the procedure, anesthetize the child. And typically I supervise some nurse anesthetists who work with me, so that I'm able to leave the operating room and come see the next patient while they stay with the patient. And that also allows me to do 2 patients in 2 different operating rooms at the same time, so I can move back and forth between different types of cases.
Okay. How has your job affected your social and emotional life?
Well, fortunately, my wife is also an anesthesiologist, so she understands the time commitment it takes. Starting off with medical school is a huge commitment. And then after medical school, you have residency for anywhere from 3 to 9 years, depending on what specialty you pick. And those are going to be 80 to 100 hour per week weeks. So you're going to spend a lot of time away from your friends and family. You're going to sacrifice a lot, both, as you said, the emotional side and financially, because all that time you're really not being paid very much, and your friends that went to college with you are out driving their BMWs or whatever now, and you still have your 14-year-old Chevy. So it does, and even now, I often miss soccer games, lacrosse games, events at school, because I have a commitment to be at the hospital.
What do you feel is your most memorable memory as a pediatric anesthesiologist?
Oh, I think when you take care of some kids who are really, really sick, and you have an impact on helping them get a cure, those are the things that stick with you. On that similar note, there are some kids who were very, very sick that you weren't able to help, and that really tears at you for a long time.
How many years have you been practicing pediatric anesthesiology?
I have been a pediatric anesthesiologist for 15 years. Prior to that, I was an adult anesthesiologist for 7 years. And for 10 years before that, I was a research person. So it's been a long time.
What kind of research did you do?
Our lab that I was involved with, we were trying to figure out how anesthetics work. And to this day, we still don't really understand exactly the mechanism of how anesthetic drugs work.
That's interesting. What's the most difficult aspect of your job as a pediatric anesthesiologist?
I think the most difficult thing is making judgments on when you may have to stop a surgery. The surgeon obviously wants to complete the whole surgery. There may be times when the child just is not well enough to continue on with the surgery. We could do more harm than good. So we have to communicate with the surgeons and make decisions jointly.